Good morning, ladies and gentlemen. Thank you very much for giving Zambia the opportunity to share the country experience on Hologic Panther. As a Ministry of Health laboratory unit, we have a vision, we have a mission also. Our vision is to have a functional and sustainable laboratory service for all the Zambians. And our mission is to provide Zambians with high quality, accurate, timely, cost-effective, and appropriate laboratory services at all levels of care and as close to the community as possible. We have 10 core functions of our lab unit, and these include the laboratory management and coordination, equipment procurement, placement and distribution, laboratory supply chain and coordination, clinical diagnosis, disease prevention and control, surveillance, reference and specialized testing, quality systems management, capacity building for laboratory testing and personnel, as well as laboratory accreditation. So this slide shows the laboratory network in Zambia. We have a total of 608 laboratories, and out of that, we have 534 functional laboratories, and that's how they are distributed in Zambia. We have 10 provinces, and you can see the numbers in each province. In Zambia, we have adopted the multi-disease testing on both the conventional and the point-of-care platforms, and most of the decisions of equipment placement are aligned to this policy direction. And we've got our multi-disease point-of-care testing guidelines in place, and our priority tests include TB, viral load, EID, HPV, and COVID-19. So this is the footprint of Hologic Panther in Zambia. Like I said, we have 10 provinces, and in each province we have at least one Hologic Panther, except for Copperbelt Province and Lusaka Province, where we have 2 platforms and 3 platforms respectively. And this is the performance of the HIV viral load testing. The green bar represents testing on the Hologic Panther platform, and the red bar represents the total tests with other platforms that we use in Zambia. And the trend that we have seen is an increase in the volume. And like has already been mentioned, volume guarantee is critical in sustaining the operations of these platforms, as well as providing quality service to the community. This is the HPV testing on the Hologic Panther. Again, we see an increase in the volume from year 2021 up to now. This is the SARS CoV-2 testing trends. Year 2020, when we just started testing on the Hologic Panther, those are the numbers. And last year, the numbers increased. And this year, we're still testing, and we can anticipate that the numbers will also be high, considering the way the pandemic is going. It will reflect to that. What are our successes and opportunities from this multi-disease testing? We successfully integrated multi-disease testing, and we also saw an expansion of molecular diagnostic capabilities throughout Zambia. And then we also bridged the lab clinical interface for the scale-up of cervical cancer screening. And our opportunities, again, we saw a reduction in equipment downtime, and then also availability of reagents and consumables, and the need for in-country equipment super users is very also critical. So in conclusion, multi-disease testing is achievable and highly efficient, and this provides training to the human resource. As you know, the same human resource that is doing HIV viral load is the same human resource that is doing SARS CoV-2 and also HPV. Political will and partner support is also critical and important to achieving this. Then timely repair of equipment is also critical for optimal service delivery, because if the equipment is broken down, you can imagine all the 3 tests are not going to be carried out. The COVID-19 pandemic also provided us with a learning opportunity on how to effectively integrate multi-disease testing. Thank you very much.